Hi, my name's Michelle and I'm the practice manager here at Endocrine SA. Telehealth, it's been a bit of a roller coaster. We didn't know what we were doing. Nobody was willing to put their neck on the line and tell us what the standards were. Medicare told us to go to our local college and ask their opinion. The local college directed us back to Medicare. So basically we were on our own. So we did their research by ourselves, looked at all the multiple programs that were available, and there are a lot out there. A lot of them have extra features that may be more suitable to your practice, but we decided to go with a fairly simple one called video. One of the biggest issues, I guess, is making sure that the other practice has the same software because, as you are probably aware, different software programs will not speak to each other. So that was one of the biggest issues that we had. Other than that, we got our IT department involved in setting up the computers and buying cameras and speakers, and it didn't turn out to be an overly expensive operation, so keep it simple. Clerical and billing, basically like communication between the two practices is vital. You need to set up times and dates that suit both practices as well as the patient. You need to keep both practices informed at every step of the way. I believe that when you're choosing your software, you really need to be aware of patient confidentiality and the security of the transmission. As we're all aware, there are hackers out there, there are people that can access computer transmissions, so make sure that it is encrypted for the security of your patient and your practice. Now, we've also found it beneficial to test both practices' software and the connection at least a few days beforehand. And while you're setting up the software and the appointment lists, you're always communicating with other people at the other end, be it the doctors, the receptionists, the IT staff. So when you finally get to see them on screen, as you can imagine, it's usually quite a shock because they don't look anything like what you think they're going to. But that's always nice too. There will always be need for doctors to travel to remote areas. There will always be a need for patients to travel to cities. But telehealth is going to allow doctors to see their patients on a more regular basis and perhaps allow patients who wouldn't normally be able to travel or to access specialist services to be able to do that. So I think it's a great initiative, and I applaud Medicare for doing this.